Good afternoon, Peter Goertz. I'm a psychiatrist. Caregiver burnout. When one does psychiatric consultations, one talks obviously to patients, but also I spend a large amount of time talking to the caregivers of patients, wives, family members, children. And what's happened, for example, once when I was in an outpatient clinic talking to a gentleman with Alzheimer's, his wife was in the room on the couch next to him. And I turned to her and I asked her, how are you holding up with all this? And she just, without saying anything, burst into tears. So that tells you something about what caregivers go through taking care of people with various issues. And one thing that's important, in my opinion, is what the flight attendants say in airlines. So on a flight, you may hear an attendant say, put on your own oxygen mask first before putting it on a child, if it's necessary to use oxygen. So that's important for us all to realize and remember. Of course, it's easy to say. And another thing that is key, in my opinion, is to try and accept, and again, it's easy to say, not necessarily easy to really accept, try to accept that we cannot control another person. And as doctors, that's something that can be quite frustrating potentially. If we treat, let's say, an IV drug user with IV antibiotics for 6 weeks because they got an infection from using a non-sterile needle, then they go out and inject again with a non-sterile needle. So that can be quite difficult for a doctor to cope with sometimes. Now, in general, we cannot control another person. However, under certain circumstances, one can get what we call a power of attorney. So you would go to an attorney and ask if it's possible for you to get what we call power of attorney. And that would mean, at least in certain instances, you could make decisions for your family member, whoever it is that has a major problem that at least at times makes it impossible for them to make good decisions. Another aspect, if the issue with the person who's being taken care of is psychiatric, is that one can get, at least it's possible in various states, I don't know if it's possible in all states, it is possible to get psychiatric treatment over objection ordered by a judge. So that can be very helpful for the caregiver also. It's not perfect, but it can be part of what helps. So the people being taken care of that can create quite a bit of burden for the caregivers, for example, would be, let's say, an autistic child, but even if they're in their 20s, 30s even, they can still create a lot of problems for the caregivers. And someone with Alzheimer's is another example. Let's say your father has cognitive issues plus psychiatric issues. He's spending enormous amounts of money and nothing is stopping him. And these people can really come to harm. They can run out of money, be taken advantage of, and physically also suffer if they don't take their medicines, which they often may not do. And a psychotic child is another example. Another potentially heartbreaking example is drug users. So family members of drug users, you may have a brother, a sister, a child who injects IV heroin and has overdosed multiple times. And then one day you find that child or brother, sister dead. So that's a heartbreaking situation. So again, in general, we cannot control other people, which can be very, very sad. And, the person who died could have children also, so it really can have major ramifications. Our medical system in the US, at least, is far from perfect. There can be areas, let's say if you have a psychotic family member, there can be areas where there's no psychiatrist for miles and miles, or maybe no psychiatrist who accepts your insurance. So the person, and this happened to me recently, I saw a patient who ended up becoming violent, and he'd run out of medications because he couldn't get them. And that's really unfortunate. It's kind of a breakdown of our system, and it's connected with the social system. So he ran out of medicines, became violent, and was taken to the emergency room. Another aspect that can help is, let's say it's the person who needs care is a psychiatric patient, so someone with psychiatric issues. There are day programs that can really be enjoyable for the patients to attend, but also they can be very enjoyable for the caregivers, because let's say if the person being taken care of goes to a day program 5 days a week, let's say 9 a.m. to 3 p.m., that means the caregiver has a lot more free time, a lot more time to relax, recuperate. So that can be maybe even life-saving for the caregiver. Another aspect is, I'm not an expert with this, but to my knowledge, it is possible for caregivers at times to be paid to be a caregiver, let's say maybe by the patient's insurance. So instead of having a home care person come in and do the care, let's say a visiting sitter or a nurse assistant come in, you as a wife or daughter may be able to get paid potentially by the insurance of the person, of the patient, to take care of that person. So that also financially can create a little bit of balance. And you also want to try and stand up for yourself. There are situations where, let's say, one sibling takes care of the parent, but there are 5 other siblings who don't do anything for the parent. So that is not necessarily fair, and as a family member, you want to try your best to stand up for yourself and see if at least potentially someone else can help out to take care of the person who needs the care. So bottom line, it seems important to try and have adequate time for yourself, for relaxation, for fun, for balance, so that you don't burn out taking care of whoever it is, husband, wife, child, father. And it's easy to say, of course, but I think it's true. But again, it can be very difficult to achieve, to have free time, to take care of yourself when you really, let's say, you have other people to take care of, you have other children, and one of the children is autistic. It can be overwhelming. Thank you very much.